Cancer is the second leading cause of death in the United States and has held that title for decades now. It's become so much of a silent epidemic that 1 in 2 American men and upwards of about 35 to 40% of women will get an invasive cancer within their lifetimes. Genetic causes of cancer range from around 5 to 15% for all cancers, which means overwhelmingly that cancer is mainly caused by other risk factors and can be quickly and effectively treated if caught early during its precancerous or very early stages. Join Dr. Levandovsky MD from Preventive Medicine and Cancer Care in Denver, Colorado, as he discusses what is cancer and how does it formulate in the body.
Let's talk about the first subject, which is cancer, because to talk about cancer first, we need to know what it is, because there's lots of myth about it and there's lots of misnomers. So this is a normal cell, and the job of a normal cell is to replicate and make daughter cells. So identical daughter cells which further divide, and lo and behold, mistakes happen. Because we're human, it's our job to replicate, and it's inevitable often that we make mistakes. Our gut lining renews itself with a few billion cells. Mistakes happen inevitably, and there is a built-in mechanism of harakiri. You know, the cell is supposed to suicide, it's supposed to kill itself if there is damage. Now, what happens if the damage doesn't cause a death? If there is propagation. There are multiple steps, 2, 3, 4, 5, before cancer develops, and there are certain elements, there are certain chemicals, growth factors, insulin, what we expose to in the environment that helps to pave this process of moving from 1 mistake to 2 mistakes, 3 mistakes, 4 mistakes. And what's important to know is that this is arrestable, meaning if someone's here, they don't have to inevitably progress, and sometimes they can actually reverse back. And things that put us at risk for this progression are genes, but we can't really modify how we've picked mom and dad. You know, it is what it is. But we can certainly affect catalysts that lead here. And this is a Western lifestyle. How does this play out? Let's look at a classic model of colon cancer. So this is the inside of a colon. Imagine that, you know, stool is here, and you have another layer up here. So we typically recommend a colonoscopy to screen for colon cancer every 10 years, because we think that it takes about 10 years to go from here to there. For an average person, it takes about 10 years to have that development. So step 1, step 2, step 3. But it really depends on genes and exposure. So for some people...